Vaginal bleeding is usually defined as any bleeding from your vagina that's not part of a menstrual period. There are many reasons you may be bleeding. In most cases, it's not life-threatening and not a cause for concern. Most vaginal bleeding can be attributed to medical conditions, pregnancy or hormonal changes. What therefore is vaginal bleeding? Vaginal bleeding is any bleeding from your vaginal area. It can refer to bleeding related to menstruation or bleeding unrelated to menstruation, such as from trauma or a medical condition. In most cases, vaginal bleeding refers to bleeding that's not related to menstruation, your period. Bleeding between periods or bleeding outside of a normal menstrual cycle is abnormal, irregular, vaginal bleeding. This type of bleeding can be random, impossible to predict, and may be accompanied by pain or other symptoms. Vaginal bleeding not caused by menstruation can be caused by many factors like health or medical conditions, medications, pregnancy, hormones, menopause, injury or trauma, infection. Who is more likely to experience vaginal bleeding? Unusual vaginal bleeding may occur at any age. When a person first begins having periods, they may not always occur on a regular schedule. The same is true in the years leading up to menopause. During this time of perimenopause, the number of days between periods may change, be skipped altogether, or bleeding may be unusually heavy or light. There are many causes of vaginal bleeding other than menstruation. You should always work with a healthcare provider to determine the cause of your bleeding. Some of the more common causes are medical conditions, hormones and pregnancy complications. Medical conditions. 1. Cancers of the female reproductive system. These can include cancers of your cervix, endometrium, lining of your uterus, ovaries or fallopian tubes. 2. Bleeding disorders. A problem with normal blood clotting can result from an inherited condition, such as hemophilia or von Willebrand disease, a low red blood cell count, thrombocytopenia, a deficiency of vitamin K, which helps the body make blood clotting factors, or as a side effect of medications, such as blood thinners. 3. Hypothyroidism. An underactive thyroid gland can interrupt normal menstrual cycles. 4. Uterine fibroids. Non-cancerous growths that develop from the muscle tissue of your uterus. Their size, number, growth rate and location within your uterus can vary greatly. 5. Adenomyosis. A condition where the lining of your uterus grows through the uterine wall. 6. Uterine, endometrial, polyps. An overgrowth of cells on the lining of your uterus. Polyps are usually not cancerous, but some can develop into precancerous polyps. 7. Severe cervicitis. Cervicitis is inflammation or infection of your cervix. 8. Endometrial hyperplasia. The endometrium becomes too thick, usually due to a hormonal imbalance of estrogen and progesterone. This condition isn't cancerous, but in some cases can lead to cancer of your uterus. Hormones. 1. Anovulation. A disruption or failure of your ovaries can be due to a disorder of your ovaries themselves or from a problem in how the brain is signaling the glands that control ovulation. 2. Hormonal birth control pills. Some people experience breakthrough bleeding while taking oral contraceptives. The problem tends to resolve on its own. Pregnancy complications. 1. Ectopic pregnancy. A pregnancy in which a fertilized egg grows outside your uterus, usually in your fallopian tubes. 2. Placental abruption. Detachment of the placenta, the sac that contains a fetus, from the wall of your uterus. 3. Placenta previa. When the placenta lies low in your uterus and partly or completely covers your cervix, the opening to your uterus. 4. Preterm labor. Labor that occurs before the 37th week of pregnancy. 5. Miscarriage. Loss of pregnancy before the 20th week. Other possible causes. 1. Birth control devices. Using birth control devices such as the intrauterine device, IUD, can cause spotting. 2. Hormone replacement therapy. A treatment used to relieve symptoms of menopause. 3. Infection. This can occur in the pelvic cavity or urinary tract. It can also include bleeding caused by sexually transmitted infections, STIs. 4. Injury to or a foreign object in your vagina. 5. Cervical or endometrial biopsy. A biopsy is a procedure where tissue is removed from your cervix or uterus and examined for problems. Can stress cause vaginal bleeding? Yes, stress can affect your hormone levels and contribute to irregular vaginal bleeding or irregular menstruation. If you find this study interesting, please subscribe for more. Thanks for watching. God bless you.